In Paris, the U.S. men's basketball team was down by as many as 17 points to Serbia in the semifinals. With gold medal expectations and on the world stage, Steph Curry led the star-studded team, scoring 36 points and 9 three-pointers, resulting in a storybook comeback win. In the gold medal game, the hometown crowd cheered France to within 3 points with 3 minutes to go. Steph Curry then made 3 consecutive three-point shots, including a high-arcing fade over 2 French defenders to seal the victory. It was inspiring to watch individual and legendary NBA rivals come together as one. I am confident the patients in our community have a dream team of caregivers and helping hands who come together in a similar manner. It is inspiring to watch your individual talent and see patient outcomes only possible because of a many minds approach. Thank you for being here. Thank you for what you do. Thank you for being willing to come together as a community with the objective of helping our patients get their lives back. Thank you, thank you, thank you. You are all inspiring. My wife and I celebrated our 20th anniversary and welcomed our 5th child and first daughter in the month of July. It was a wonderful time for our family. However, a few days after Ella was born, I learned a patient intended to file a lawsuit. It deflated my joy, and I could think of little else. Furthermore, even when not working, I had to respond to some insurance denials and handle a few other burdensome tasks. Then, just 9 days after Ella was born, I went back to work and took call at the hospital. I was not ready. I started back on a Friday and operated all day. I operated Saturday and Sunday. I operated until 7 p.m. on Monday and until 9 p.m. on Tuesday. I also saw consults, answered messages from clinic, and attended to several administrative duties. By the time I went to bed at 11:30 p.m. Tuesday night, I was exhausted and was burnt out. The phone rang at 1:30 a.m. The ER doctor had a 36-year-old woman who recently started using heroin who had not been able to move or feel her legs for 3 days. She had no control of her bowel or bladder. On her MRI, she had a large epidural abscess in her thoracic spine with spinal cord signal change. I looked at the images, then told the ER doctor there was little chance for the patient to regain neurological function. The patient needed surgery, but I would do it in the morning. A few hours wouldn't matter. I was tired, I thought to myself. I needed the rest. I was burnt out. Honestly, I didn't feel empathy for the woman. I hung up the phone. I've reflected on that moment for the last 2 months. How does a 36-year-old woman end up in such a horrible and dire situation? Also, why did I feel the way I did? After all, I went into medicine to help people. Why did I feel so indifferent? Our society has seen incremental changes over the last several decades that have negatively impacted our health. The average American now spends 7 hours per day looking at a screen. 41% of American teenagers have a screen time of more than 8 hours per day. Nearly 70% of calories in kids' diets are derived from ultra-processed foods. On average, we eat 17 teaspoons of added sugar per day, 3 times the recommended amount. Only 24% of adults meet the physical activity guidelines for aerobic and muscle strengthening exercises. Those with chronic diseases have an even lower rate of exercise. More than half of Americans get less than 30 minutes of exercise a day. An amazing fact of modern life is we don't have to move around to do anything. 100 years ago, people got 5 times more exercise every day just during daily living. As a result of artificial and toxic substitutes for food and social connection, a lack of exercise, and many other environmental and cultural factors, we are burdened with diseases of metabolic dysfunction like never before. The prevalence of obesity, a condition rarely seen 100 years ago, has steadily been on the rise. Over 70% of Americans are overweight or obese. Half of American adults have prediabetes or diabetes. 30% of teens have prediabetes. 18% of teens have fatty livers. Cancer rates are going up. 25% of American women are on an antidepressant. 40% of 18-year-olds have a mental health diagnosis. Other conditions such as infertility, autism, and autoimmune disease are rising. 90% of the annual $4.5 trillion healthcare expenditure is attributed to managing and treating chronic diseases and mental health conditions. We don't have a healthcare system. We have a chronic disease management system. The burden of disease has contributed to the burden on all of us. Caregiver burnout is a long-term stress reaction marked by emotional exhaustion, depersonalization, and a lack of personal accomplishment. We saw burnout at a record high, 62.8% in 2021, and per the AMA was just below 50% on the day Ella was born, July 2nd, 2024. We spend 43% of our time on data entry. We only spend 28% of our time with patients. Since 2001, Medicare reimbursement has declined 29%, while the cost of running a practice has increased almost 50%. We are working harder, taking care of sicker patients for less. Perhaps disgruntled by and distrusting of overburdened caregivers, our patients are left seeking answers. The global wellness economy was $5.6 trillion in 2022. Companies thrive selling products that advertise marvelous health advantages. Social media influencers and podcast hosts have popularized a contradictory menu of biohacks, supplements, and rigid protocols. Unfortunately, many of our patients turn to truly harmful quick fixes. Drug overdose deaths in the United States since 2000 are nearing 1 million. Half of Americans 12 and older have used illicit drugs. 21.4% over the age of 12 have used illegal drugs or misused prescription drugs within the last year. 1.1 million Americans, including my patient, used heroin in the last 12 months. After I hung up the phone that night, I knew I should immediately take the patient to surgery. Somehow, a deep sense of empathy and compassion came over me. At 2 a.m., just before going back to the OR, and after I discussed with the patient what we planned to do and the likelihood she would not walk again, I realized the anesthesiologist for the case was the same anesthesiologist who repositioned my wife's epidural 2 weeks previously to the day, also at 2 a.m., after 10 hours of labor. Ella was born 30 minutes later. I told the patient, who was emotional and fearful, not to worry. I knew from experience that her anesthesiologist does his best work at 2 a.m. I did not mention, however, that I definitely do my best work during regular working hours. During surgery, we evacuated a large abscess from the patient's spine. I arrived home at 4 a.m., slept for a couple of hours, then returned to the hospital. When I rounded on my patient in the ICU, to my surprise, she was moving her left leg. Today, she is working to regain her ability to walk independently. It was only after treating her that I discovered she too has a young child, a 1-year-old she is working hard to make it back to. It is an honor to serve our patients. We see miraculous outcomes every day. We need to recognize the environmental and cultural problems plaguing our patients and our health caregiver well-being. We need to see these issues not as individual patients' lack of willpower, drive, or self-control, or a caregiver's lack of work ethic and empathy, but as community and system issues. It is really hard for all of us to eat a healthy diet. It's sometimes difficult to limit screen time. It can be a challenge to find time to regularly exercise. Many of us have experienced increased workloads, less autonomy, and less appreciation, which is the very recipe for burnout. In summary, it is hard to be healthy and help patients become healthy in America today. With the obvious decline in our health, we conclude no amount of money or treatment will overcome the current levels of metabolic dysfunction in our population. Therefore, we need to change the paradigm. Fortunately, health and longevity really doesn't need to be complicated or expensive. Research has shown time and time again that exercise, nutrition, and social relationships and the avoidance of harmful substances makes all the difference. This is the message our community needs to hear loud and clear. In this effort, according to a New York Times article by Brad Stolberg, we face a dilemma. The key to longevity is boring, and nobody stands to profit. So what is to be done, and why should we care? We should recognize our health is a community problem that requires a community solution. It involves you and I coming together to help unravel the incremental issues that led to this problem with our own incremental 1% improvements. It's a commitment to help each other stay engaged on the front lines of medicine while still seeking to address the root causes of patients' issues. We must be able to help each other and our patients take the long view because quick fixes rarely make for lasting results. The slower, steadier, and even boring approach is needed. We should seek to practice medicine this way because we want to regain the trust patients have lost in our healthcare system and have the greatest and most lasting impact on their health. My invitation: consider throughout this conference how we can make incremental, small efforts each day that will help all of us live the healthiest lives possible. This conference is all about enabling the individual and the team to succeed in achieving wellness and longevity for our community. Thank you.